Thank you very much, Mr. Speaker. My question is to the Minister of Health, Speaker. Gastroenterologists over the years have learned that if you have early intervention when it comes to people, when it comes to colon cancer, that you can really turn the outcomes around. And one of the things that gastroenterologists have been able to do up until recently is that if they had a patient that they thought, you know what, we should keep a closer eye on you because your polyps grow faster, or maybe they saw something in the last one, they are able to bring that person in for a colonoscopy more frequently, every year, every 2 years, every 3 years, whatever they think. But normally it's their call. Your government has now changed this, so now it's every 10 years. Not at the call of the call of the specialist. Why is the Ford government, Mr. Speaker, trying to micromanage what physicians and gastroenterologists are supposed to do?
Minister of Health.
Well, I've said this many times, the health and well-being of the people of Ontario has always been our government's top priority, and we have provided physicians and primary care providers with the tools that they need to do their work. In a situation such as you've just described, if someone needs to have a surgery done or have a test done more frequently, that's certainly up to the provider to provide. We have room in our hospitals. We have provided hundreds of millions of dollars for equipment. We've invested $5.1 billion in creating another 3,100 beds, and that's across the province of Ontario. That's every part of Ontario. So it's clear that if it's called for in patient care, that this work can be done on a more frequent basis, not once every 10 years, but whenever it's needed.
Supplementary.
Mr. Speaker, that's just not the case. What the government has done is that they've restricted the ability of gastroenterologists to be able to do colonoscopies and only be able to do them within that 10-year period in very, very narrow circumstances. If the person's passing blood, if, different things like that. But you know as well as I do that a lot of colon cancer is caught how? By going for a colonoscopy, not waiting till you start bleeding or start feeling ill. And what gastroenterologists are saying, why are you trying to micromanage the work that they do and making sure that patients are safe? So I'll ask you again, why is this government, Mr. Speaker, so intent on micromanaging decisions that should be made by our medical community and instead insert themselves inside and say, oh, every 10 years, everything will be fine? Because it won't.
What we do is follow best practices of the province of Ontario. However, if there's a situation where a gastroenterologist believes that someone needs to have a test done within that 10-year period, it's perfectly available for them to do so. It absolutely is. We have the machinery, we have the equipment, we have the availability in hospitals or in suites where that can be done. And if someone has a history, if someone has a family history or some history of trouble themselves, they will be followed more closely by their primary care physician and by their gastroenterologist, and that they need to have that done more frequently than 10 years. Those tests will be done.